Hi, Assalamualaikum and good day everyone. My name is Shifa Waikis binti Muhammad Zamir, and today our group will be presenting our enterprise resource planning project, and our chosen domain is the hospital industry, where we focus on how the human resource module integrates with other functional areas to improve the hospital operations. Hospitals operate in a highly complex environment that they must manage the patient care, healthcare professionals, administrative staff, financial operation and also the regulatory compliance simultaneously. Handling all of this process must be manually and can be time-consuming and may lead to the inefficiencies. Therefore, many hospitals have adopted ERP system to integrate different departments into a single digital platform by connecting modules such as human resources, finance, and hospital operation, also training and compliance. ERP may be enables better communication to reduce the redundant processes, improve the operational efficiency, and also support the better decision making. Now, let's begin with the human resource functionalities within the ERP system.
Now, let's explore the specific functionalities that the HR module of an ERP system offers to hospital. The HR department is pivotal because it manages the hospital's most valuable asset, which is its people. The first key functionality is recruitment and talent acquisition. An ERP system automates the hiring process through tools like automated job postings, applicant tracking, and candidate screening. This drastically speeds up the process of filling critical clinical positions. Secondly, the system provides advanced workforce planning and scheduling tools. Hospitals operate 24/7, so having the ability to forecast staffing needs and create rotational rosters for nurses and consultants is essential to ensure adequate coverage across all departments at all times. Moving on, the ERP system also includes robust time and attendance management functionalities. This allows the hospital to accurately record each employee's working hours, track overtime, and manage the varied shift patterns that are common in healthcare. Closely linked to this is payroll administration. The system can efficiently process salaries, benefits, bonuses, and deductions, and it is capable of handling complex scenarios where staff may perform multiple roles with different pay rates or receive on-call allowances. Additionally, performance management tools are integrated to support professional development. These tools allow managers to set goals, conduct appraisals, and document feedback, all of which contribute to the continuous growth of the hospital's workforce. Another critical functionality is training and compliance management. In the healthcare industry, staff must maintain valid certifications and complete mandatory training to comply with stringent regulations. An ERP system tracks these requirements and alerts HR when renewals are due, thereby ensuring the hospital remains compliant and avoids penalties. Finally, modern ERP systems include employee self-service portals. These are mobile and desktop interfaces that allow staff to independently access their personal records, request leave, view pay stubs, and update their information. This not only empowers employees but also reduces the administrative workload on HR professionals. Now, let's discuss the tangible benefits that these HR functionalities bring to a hospital. The first major benefit is a significant increase in operational efficiency. By automating routine tasks such as onboarding, leave management, payroll, and benefits administration, the ERP system frees up HR professionals from tedious manual work. This allows them to redirect their efforts toward more strategic activities like workforce planning and employee engagement. The second benefit is improved data accuracy. Having a centralized system ensures that employee data is consistent and reliable. In a highly regulated environment like healthcare, this accuracy is absolutely essential for maintaining compliance and making informed decisions. Furthermore, the ERP system greatly enhances regulatory compliance. With its ability to generate timely reports and maintain detailed audit trails, the system makes it much easier for hospitals to demonstrate compliance with labor laws and healthcare regulations, thereby reducing the risk of costly penalties. Another significant benefit is cost reduction. The system's advanced scheduling and capabilities help minimize unnecessary overtime and reduce the hospital's reliance on the expensive temporary agency staff. Additionally, accurate payroll processing reduces the likelihood of overpayments and other administrative errors, ultimately saving the organization money. Beyond efficiency and cost savings, the ERP system also contributes to higher levels of employee satisfaction and engagement. The self-service functionalities we mentioned earlier empower employees by giving them convenient 24/7 access to their personal information and HR services. This transparency and ease of use foster a sense of autonomy and trust within the workforce. When employees are satisfied and engaged, they are more productive and more likely to remain with their organization, which is a critical factor in addressing the high turnover rates often seen in the healthcare industry. Ultimately, the most profound benefit of implementing an ERP system in a hospital is its positive impact on patient care. By reducing the administrative burden on both HR teams and clinical staff, the system allows physicians, nurses, and other caregivers to focus their time and energy on what they do best, which is providing high-quality care to patients. When clinicians are not bogged down by paperwork and scheduling issues, they can dedicate more attention to their patients, leading to improved patient outcomes. In this way, the ERP system is not just an administrative tool, it is a strategic enabler that contributes directly to the hospital's core mission of healing and saving lives.
Good day everyone, my name is Damia and I will present the HR process flowchart for our hospital ERP system. The flowchart illustrates how the human resource model manages the staff scheduling process in a hospital. Since hospitals operate 24 hours a day, having the right number of qualified staff for every shift is essential to ensure continuous patient care. The process begins when the department manager identifies staffing needs for upcoming shift. After determining the required numbers of employees, the staffing request is submitted to the HR department through the ERP system. Next, the HR department checks employee availability by reviewing information stored in their ERP system, including work schedules, leave records, and employee availability. The system then determines whether there are enough staff members to cover all required shifts. If sufficient employees are available, the ERP system automatically generates a work schedule based on staff availability and hospital requirements. The department manager reviews the schedule to ensure it is appropriate and meets operational needs. Once approved, the schedule is published to employees through the ERP system. Employees can then view their assigned shift, making communication faster and more efficient. Finally, employees clock in and out during their shift, and their attendance is automatically recorded in the ERP system. The recorded working hours and overtime are then transferred directly to the payroll module, where employees' salaries are calculated accurately. This integration eliminates manual data entry, reduces payroll errors, and improves the overall efficiency of hospital operations. In conclusion, the HR process flowchart demonstrates how an ERP system streamlines staff scheduling, attendance, tracking, and payroll process while ensuring hospitals have enough qualified staff to deliver quality patient care.
Assalamualaikum and hi everyone, my name is Nurnaili and I will present for the part B, which is about the integration between the human resource module and other functional areas in a hospital ERP system. We have chosen three financial areas, which are finance, hospital operations, and training and compliance. First, let's look at the integration between HR and finance. The HR department manages employee information such as attendance, leave records, overtime, and salary grades. This information is automatically shared with the finance department. The finance module through ERP system, and they use the data to calculate salaries, overtime payments, allowances, taxes, and other deductions before generate pay slips. This integration helps to reduce manual work and also minimize payroll errors to ensure that employees receive their salaries accurately and on time. Next is the integration between HR and hospital operation, which focus on staff scheduling. Since hospital operate 24 hours a day, it is important to have enough staff like doctors, nurses for every shift. The HR module provides information such as employee qualification, department availability, and approved leave. This information is to prepare duty rosters and assigns employee to suitable shifts. After they completed their shift, the working hours and overtime records are sent back to the HR module to payroll processing. This helps the hospital to avoid scheduling conflicts, improve workforce planning, and ensures that there are enough qualified staff to provide quality patient care. The third integration is between HR and training compliance. In hospital, employees are required to attend mandatory training and maintain valid professional certification. The HR module stores employee information and certification requirements. This information is shared with the training module, which scheduling training sessions, record employee participation, update certification status, and send reminders before certification expire. It helps the hospital ensure that all employees remain qualified and comply with the healthcare regulations while reducing the risk of expired certification.
Assalamualaikum and hi, my name is Maulida Rizka and I will be explaining about the EPC diagram. Before I explain the diagram, I would like to briefly introduce what an EPC diagram is. EPC stands for Event-Driven Process Chain. It is a process modeling tool used to show how business activities are connected. In an EPC diagram, events trigger functions and the completion of each function leads to the next event. It helps organizations understand and improve their business process. Now, looking at this diagram, the process starts when employee information is available. HR then updates and maintains the employee records. Once the records are successfully updated, the process reaches an end connectors, which means it splits into 3 processes that run at the same time. The first process is finance, where payroll data is transferred, salaries are calculated, and payslips are generated, and salary payments are being processed. The second process is scheduling, where employee information is shared to create work schedules. After employees complete their shift, their attendance and overtime are updated back to HR. The third process is training and compliance, where employee records are shared to schedule mandatory training. After employees complete the training, their certifications are updated and reminders are sent before certificates expire to maintain the compliance. Finally, all 3 processes join together in another end connector. This means every process must be completed before the HR integration is finalized. The process ends with the HR integrations completed, showing that all modules have successfully worked together.
The first swim lane diagram illustrates the integration between the human resource module and the finance module. The process begins when HR updates the employee information, including the attendance record, overtime, leave application, and also the salary grade. This information is then automatically transferred to the finance module through the ERP system. And then the finance processes the payroll by calculating the salaries, allowance, taxes, and statutory deduction before generating the employee's pay slip. Finally, the payroll information is recorded and stored in the ERP database. This integration eliminates the duplicate data entry, improves the payroll accuracy, and ensures the employees are paid on the time. HR first update the employee details such as qualification, department, availability, and leave status. The scheduling module then uses this information to generate duty rosters for doctors, nurses, and other healthcare staff. After employees complete their assigned shift, the attendance and overtime records are automatically sent back to the HR module for payroll processing. This integration helps to reduce the scheduling conflicts, improve workforce planning, and ensures sufficient qualified staff are available to provide quality patient care. The final swim lane diagram presents the integration between the HR module and the training and compliance module. HR shares employee records, job roles, and certification information with the training and compliance module. Based on this information, the system schedules mandatory training sessions, record employees' participation, updates the certification status after training, and sends the reminders before certification expire. This process helps the hospitals to ensure employees remain qualified and comply with healthcare regulations.
In conclusion, this project shows how an ERP system can integrate the HR module with finance, hospital operations, and training and compliance in a hospital. By sharing information automatically between these departments, the system improves efficiency, reduces manual work and errors, and ensures accurate payroll, effective staff scheduling, and compliance with healthcare regulations. Overall, ERP integration helps hospitals manage their workforce more effectively, allowing healthcare professionals to focus on providing quality patient care. That's all from us. Thank you.